I'm a health psychologist, and I have worked at Living Cancer Institute with oncology patients for several years. I recently transitioned to a new position, but oncology is my passion. And as a health psychologist, addressing quality of life is kind of my bread and butter. So we are going to talk about quality of life today. We're also going to do some exercises together, and I will say, please do whatever you're comfortable with. If I'm mentioning something and you're like, don't really want to participate in this thing, that is totally fine. Please do what you're comfortable with. Don't do anything that makes you uncomfortable. But I have planned for this to be interactive, so hopefully that will be the case. So first, I'm going to just do a brief introduction, talk about some of the research, some of the data. Then we are going to talk about some very specific ways to address different areas of quality of life, and I will talk about what that looks like. And then at the end, we're going to just summarize what I talked about. I'm going to give you a little challenge at the end as well. So when we talk about quality of life, what are we talking about? What do we mean? So we can look at the World Health Organization's definition. I think that was a good one. It is your perception of life in relation to your goals, expectations, and concerns in the context of your culture and value systems. So this is a very broad concept. Quality of life can look very different in different areas of life, and we can think about different factors that can influence quality of life. So I have some up here, some relevant factors. So there are physical factors, so your pain experience, your functional mobility, sexual health. That's a really big area of mine, a really important area of quality of life. We also have, kind of my area, the mental, psychological, emotional, and cognitive quantities of quality of life. And then we also have things like your spiritual life, relationships, your life roles as maybe a partner or a mom or a daughter or any of those in between. Your level of autonomy, your immediate environment that you live in, your level of freedom and health, wealth and finances. This is not an exhaustive list. This is just some examples that you can have, a different quality of life in all of these different areas. And I promise my slides are not going to be this wordy. Just the first few are just given a lot of information. So I thought it was important to just highlight some of the research. So I think that first bullet point is really important. So when we look at quality of life, it tends to be lower in lung cancer survivors when we compare quality of life to other survivors of other cancers. So that is because there are a lot of symptoms, and the severity of symptoms for lung cancer survivors either in the short or long term. So those might be things like chronic fatigue, loss of appetite, shortness of breath, chronic cough, chronic pain, so things like that. And that's obviously not an exhaustive list either, but those are some common factors when we look at lung cancer survivors. And so one study also showed that 5 years post-diagnosis for lung cancer, 15% of survivors actually had an improvement in quality of life, while 35% had a decline. So obviously much more had a decline in quality of life. This was really an interesting study. It showed that the decline in quality of life was similar for those with and without recurrence. So that suggests that recurrence or progression are not the only factors related to quality of life. So I thought that was really interesting. And then I think this one is a little bit like, well, yeah, it makes sense that if you have a poor quality of life, you're probably going to have more of a depressed mood, right? That is, your mood and your mental health certainly is related in kind of a cyclical fashion with quality of life. And then, of course, I know we have caregivers here, and oftentimes you all are overlooked, but it is important to also consider caregiver quality of life. And when caregivers are caring for depressed patients or patients with more physical symptoms, their quality of life tends to be worse as well. So that's kind of what we're looking at in the research. Components of quality of life that I'm going to be addressing today, again, are more in my realm as a health psychologist. So we have chronic pain. chronic fatigue. Adjustment difficulties. So adjusting, and I think Dr. Wentworth was mentioning this too, kind of when you are done with your active treatment and they kind of just like let you go, and you're not really sure, like, who is my doctor? Who do I follow up with? Who do I talk to about all my concerns? That adjustment can be really difficult and stressful. Mood issues and anxiety and stress. So again, as a health psychologist, I'm going to focus on these things, and we'll do some little experiential exercises along the way. So when it comes to mood, the research says, right, if your quality of life is lower, your mood is probably worse. That also works vice versa, right? So if your mood is not great, then it can absolutely affect your quality of life, right? And I think a lot of this I'm preaching to the choir. You guys probably know what I'm talking about. And so it's important to kind of understand that sometimes when we can get in a cycle of depression, and this kind of starts with, you have a poor mood. Something happens, you react to it, you're sad, right? Then you start to withdraw. You start to isolate yourself. Stop reaching out to friends, stop doing things that you enjoy, which then makes you more depressed, right? So we kind of can get caught in the cycle of depression. So there is an evidence-based treatment called behavioral activation that the intention is really to break that cycle of depression. So how can we get you up, get you doing things, get you connecting with other people, doing things that are in line with your values? All the things on this slide are going to be, these are evidence-based psychotherapies, but you can take components of them and you can, run with them, use them. If you are looking for a therapist or have one, you can absolutely ask them about these things as well. So another significant part of a depressed mood is that voice in your head, the thoughts, the things you tell yourself. So I always give the example to my patients, if, I'm sitting around all day and I'm criticizing myself all day, telling myself I'm useless, I'm worthless, of course I'm going to be depressed, right? That is something in my mind telling me all day these terrible things. So it can be really important to target those negative thoughts and thought patterns. And if we think of a cognitive model, you can look at it as kind of like a triangle, and our thoughts influence our behaviors and our mood, right? And so if we intervene on those thoughts, then we can change our behaviors and our mood. And so I have two kinds of therapies up there: cognitive behavioral therapy, or CBT. That kind of therapy, in the simplest way possible, has to do with identifying negative thoughts, challenging them, and then changing them to an alternative thought that is more helpful. I don't like to say it's not going to be positive. I'm not any kind of, I always say I don't have my positive pants on. I'm more realistic. So, it's not always sunshine and rainbows. I think everyone knows that. So we want something that's going to be helpful. We want a useful thought instead of a negative, unhelpful one. Then we have acceptance and commitment therapy. So again, in the simplest way possible, components of this therapy really have to do with identifying unhelpful thoughts. And instead of changing the thoughts, you're actually learning to change your relationship to the thoughts. So it's a little bit of a different model, but it still really highlights the importance of addressing those negative, unhelpful thought patterns. And then lastly, gratitude practice. So there's some really interesting research on gratitude practice that shows that this simple thing can really improve your mood. And some examples of that, which I have used many times with many of my patients, is at the end of your day, sit down, think about, and write down 3 things that you're grateful for that happened today. But I want these things to be small things, right? So if you win the lottery, of course you're grateful for that. Yes, perfect, awesome. However, I've never won the lottery, so I can't be grateful for that. So I need to think on a smaller scale, right? So an example of that would be, someone opened the door for me when I walked in today, right? So I'm really grateful for that. I had a nice cup of coffee this morning that I got to enjoy with healthy, energetic kids screaming in the background, right? So these are things that, maybe they happen every day and you don't think twice about them. But when we actually stop, think about things that we're grateful for, and really focus on those small things, it helps us to kind of change our frame of reference. So then, tomorrow when I walk around, I'm going to maybe notice these things a little bit more because I'm writing them down at the end of the day. So again, there was a really interesting study that had people write down 3 things they were grateful for 2 weeks. And for those 2 weeks, they were happier. But interestingly, over time, that stayed stable. Right? So people who practice gratitude tend to be happier over time than those who don't. So just something to think about. Now we have anxiety and stress. So I always want to point out that it is not possible or helpful to get rid of anxiety. When I ask my patients, what are some goals when it comes to your mental health? And they say, I don't want to have anxiety anymore. I say, well, we're not going to do that. And that's not healthy or possible anyway, because anxiety has a function, right? So if we think about if you were in a threatening situation and your anxiety response kicks in, your fight or flight kicks in. That is your survival response. So you take action and you do something to survive, right? We need that anxiety response to keep us alive. The thing is that there's a small part of our brain called the amygdala. It's like a little almond-shaped part of our brain. It kind of works like a smoke detector. So how many of you have ever, burnt toast and the whole fire alarm's going off, right? I think all of us have done that at some point. So there are just some amygdalas that are a little bit more sensitive than others. So that whole smoke detector is going off, but you have just burned some toast, right? The whole kitchen is not on fire. So that is our anxiety response. Sometimes our threshold for responding is lower. And so we just really need to learn to manage that anxiety. And I also put up here some of the physiological symptoms of anxiety. And going back for a moment, again, anxiety is important. We don't want to get rid of it, but we would like to manage it, right? We would like to have it at a level where you can understand the function, but also live your life day to day, not plagued by anxiety. I will say that. So yeah, if you look at these physiological symptoms I have listed, some of them might overlap with some experiences of having lung cancer, right? So difficulty breathing, that's a big one. Feeling chest pressure, that's another one. And sometimes, our minds are incredible, but when we hyper-focus on any of those physiological symptoms, it can sometimes induce more anxiety, make it worse, right? And so hyper-focusing on those things is not usually helpful. Again, you might already have some of these things because you're a lung cancer survivor, right? So it's really important to understand that you can inadvertently add more anxiety, exacerbate anxiety. So how do we deal with this then? How do we learn to manage anxiety? I have some recommendations up here. These are just some really quick and easy tips. And again, I encourage you to, let me guide you through this and try them out here and now. So first is a grounding technique. And I really like this one because you are choosing to focus on the present. And we will talk about mindfulness more a little bit. But for this technique, it's called the 5-4-3-2-1 technique. You are actually looking around your environment. So go ahead in your mind, if you would like to participate, go ahead, just look around and just identify 5 things. Think about what they look like. Think about what's around you, what's maybe close by, what's, far away. Just think about 5 things. Now, identify 4 things you can touch. And go ahead, actually, just, give it a little feel. Is it soft? Is it hard? Is it cold? Is it rough? Is it your partner's hair? I saw that. And now 3 things you can hear. This one might be a little bit harder. Maybe one of those things is my voice. Maybe it's another voice in this room. Maybe it is the buzzing of the projector or the air. Maybe it's a noise outside of this room. Maybe it's a vehicle out on the road. And now 2 you can smell, right? So Yep, there you go. There's some food. Smell the food. There's mints nearby. Yeah, your hair. That's a good one. Yep. Your shampoo, maybe your whatever detergent you use. Got to make sure you put deodorant on. Yep. And then lastly, one thing you can taste. So if you have food, feel free to take a taste of it. If not, just kind of, see what taste is in your mouth. What snack you had earlier. Right? So this grounding method is used especially when you're feeling really anxious and you're thinking about the future or you're hyperfixating on those physiological symptoms. This grounding exercise brings us back to the here and now and puts our 2 feet on the ground using all of our senses to just absorb the environment like you were a curious scientist. And I will say that again when we talk about mindfulness. Another strategy. Has anyone here heard of diaphragmatic breathing? Yes. Yeah. Okay, good. So I think a few of you are familiar with this. So there are a lot of athletes and musicians or singers that use their diaphragm. If anyone is a musician or singer, maybe. I certainly am not, but I have heard they use their diaphragm. And using your diaphragm, your belly muscles, is the most efficient way to get oxygen into your body. So I will say, again, when you're feeling anxious, a lot of times people's breathing gets out of whack, right? They're maybe taking these short, kind of like hyperventilating breaths, and then that oxygen exchange changes, and then you feel kind of dizzy, and then your body feels really tingly and weird, right? So it creates this cascade of things in your body that tend to make you feel more uneasy, right? So diaphragmatic breathing is a relaxation strategy. However, this is one of the most important things. If you are going to use this as a relaxation strategy, you need to practice it before you're anxious, right? So if I say, just use diaphragmatic breathing whenever you're freaking out and you're really anxious, then your brain will associate the breathing practice with anxiety. So if anyone's ever played a sport, have kids who played sports, or anyone who's played a sport, they have practice before game time, right? So this is the same kind of thing. We want to train your body to calm and relax and regulate your breathing when the stakes aren't very high, right? So I always say, please, for at least 2 weeks, just take a minute out of your day, practice this kind of breathing when you're at your baseline, right? So please don't use it when you're super anxious until you have practiced it and you feel confident that you can use it. And if anyone feels up to it, again, only do what you're comfortable with. We will do a very quick, let me see what time it is, very quick diaphragmatic breathing practice right now. So what I like to tell my patients, I do this a lot, is I like to close my eyes and think about a balloon in my belly. And when you breathe in, that balloon's getting big. When you breathe out, it deflates all the way. And I want these to just be full breaths. These are not deep breaths. They are just complete. So in, the balloon gets big. And then out, just make sure that balloon is empty. One more time, in, expanding that balloon, and then go ahead and out. Another little tip for lung cancer patients, breathe with pursed lips. That can help as well when you're having a hard time breathing. I'm not sure if anyone has known that tip, but there's a little bit of research that says that diaphragmatic breathing with pursed lips can be really helpful, especially for lung cancer survivors. So not sure if anyone's heard that, but also there's some interesting research too that if you are having a hard time breathing, it can be really helpful to have some cool air. So if it is cold outside, just take a step outside. If you're near a fridge or freezer, just open that up, stick your head in there. A fan in your face can also be really helpful when you're feeling shortness of breath. If you have some air that's moving towards your face, that's also recommended.
The diaphragmatic breathing, do you breathe in through your nose?
So if you can, I recommend breathing in through your nose or mouth and then out through your mouth. And if you can, it's great. If you can exhale a little bit longer than you inhale, that's next level though, so if you can't, it's fine. You can also, there's breathing you can use with counting. I personally like diaphragmatic breathing. I don't have to count anything. I can just picture a balloon in my belly, and that's all I need to do. You can do it anywhere and everywhere. You always have your breathing. So this is a really great skill to practice. Again, please practice if you're gonna use this skill. Please practice when you're at your baseline every day for 2 weeks. Now, onto chronic pain and fatigue. As a health psychologist, our treatments for chronic pain and fatigue are very similar. And there's one intervention in particular I'm gonna talk about that we can use for both chronic pain and fatigue. I also want to mention, this is for managing chronic pain and fatigue. So when you have chronic pain or chronic fatigue, it is by definition chronic, right? So you have tried all the things to make it better, make it go away. This is learning how to live with chronic pain and chronic fatigue, right? So as a psychologist, I'm not saying it's in your head. I'm absolutely not saying that. But I'm saying that there are some behavioral strategies that you can learn to help live your life to the fullest when you have chronic pain or chronic fatigue. So first, we're going to talk about chronic pain. So by definition, if we look at the literature, there's some consensus that it is pain that lasts longer than the expected healing period. We tend to consider chronic more than 3 months. And I have this beautiful cycle. This is the chronic pain cycle. This is what, again, if you remember that cycle of depression, this is similar because at the top, that is the thing that happens. Some kind of injury, some kind of treatment, some kind of disability or distress, which then creates pain. So what happens when people are in pain? They stop moving, they stop exercising, they are sedentary a lot of the times because they don't want to make the pain worse, right? What then happens is you throw in some negative emotions, right? I can't tell you how many times I've heard people say, I'm gonna always be in pain. My pain's never gonna get better, right? I'm sure people in this room might have said that, whether it's out loud or in your mind, you might have said it. What happens then, similar to depression, is that people avoid. They avoid things they used to enjoy. They avoid doing activities that they know will cause them more pain. And they tend to also withdraw socially, right? And so then there's more disability and distress. Then there's usually more pain, right? So we can easily get caught in this cycle. So that is kind of the model we're working off of when it comes to chronic pain, right? And we are gonna try to do something to disrupt that cycle that helps you manage your pain, not necessarily get rid of it. So fatigue, also chronic fatigue, that is probably one of the main symptoms that I see working with oncology patients is that they have this chronic fatigue, either if they're in treatment or even in long-term survivorship for some of my patients. So this is that kind of fatigue, especially cancer-related fatigue. It is not fixed if you sleep or you rest, right? So that is the big kicker, is that you can be getting great sleep, you can be napping, you can be resting, your fatigue won't be touched. So it makes it really difficult to live your life. So what can we do? I mentioned I was gonna give you all a brief little intervention. What we do for chronic pain and chronic fatigue is very similar. So if we look at this chart, activity, that line, the big slope, that's gonna be activity. So for people with chronic pain or fatigue, if they do a lot of things, do a lot of activity, they pay for it later, right? You are at a commission, sometimes for days, right? So, and it could be something as simple as saying like, I'm gonna clean the kitchen today. I'm going to do all the dishes, I'm gonna mop the floors, I'm gonna vacuum. And so you do that for a few hours, and then you're like, oh no, I've really done it. And now I can't move. Now I can't move for 2 days. So we call that the point of no return. When you get there, then you're out of commission. It's no good. So the intervention that we want to use is called activity pacing. It's a fancy name for taking planned breaks. These breaks are based on time. That is one of the main things you need to remember, always based on time. So that squiggly line at the bottom, that is what someone who paces looks like, right? So they do 10 minutes of work, 5 minutes of rest, 10 minutes of work, 5 minutes of rest. or whatever that looks like for you. So when you are deciding when to take time breaks, it is not based on pain, right? You're not going to say, oh, I'll just do this until I start hurting. We're not doing that. That's too long. We don't want you to start hurting at all. Same with fatigue. You're going to say, oh, I'm just going to do this till I get tired. Nope, we're not going to do that, right? We're going to break before then. It's also not based on task completion. So if you see a full sink of dishes and you're like, I'm going to do this whole thing and then I'll take a break, it's not based on that either. It is only based on time. Does that make sense? Okay, great. Got to really drill that in because I might have some stubborn people in this room who are taking breaks but not in the right intervals. Another kind of tip to leave you with is that if at 30 minutes of break time does not get you back to your baseline for pain or fatigue, you should have taken a break sooner. So then you know that for next time and you can plan for next time. So keep that in mind. So personal values. This is a big part of quality of life, is knowing and understanding and identifying your personal values. So when I say personal values, these are things that are very individual to each person, the things that give you life and meaning deep down to your core. And I like to think about values as like a compass. So if you are holding a compass, I'm going to say for myself, I'm holding a compass, and one of my values is serving others. That's like traveling north. So I'm always going to be traveling north, right? I'm not going to be like, oh, I volunteered the other day. I have traveled north and arrived. I have checked that off. I'm good to go. Nope, I'm always going to be traveling north. My compass is here to guide me in what matters to me and gives my life meaning. And again, these are very individualized things. So what my personal values might be very different than yours or yours. And that's okay. We try not to have any judgment for ourselves or others when it comes to values. So we can also consider that there are many life areas that we have different values in. So my values as a daughter or a mom might be very different than my values as a learner or as, a volleyball player, right? So thinking about all your different life areas, you have different values in these different life areas. So I encourage everyone to consider, what are my life areas and what are things that matter to me in those life areas, right? So an example, again, might be in my recreational time, again, serving others. That's something that is meaningful to me that I like to spend my time doing. It's important to consider, am I doing anything in line with that? Am I behaving in a way that's in line with my values that has me moving north? So this can be a really great area to just take an inventory. And I can give you some examples too. It's called a values card sort. I use it with my patients. It's really fun. It's free online. If you just Google values card sort, it is the first thing that comes up. And it gives you this list of all these different values. It's usually just one word with a little definition at the bottom. And I always tell my patients, you can look at the definition, but go with what you feel that word means. So there are some things like inner peace or wealth or intimacy, right? So there are all different values. And I want to say there's like 100 of them. There's a lot. Then there's also some blank ones, so you can add in if anything is missing. But I encourage you to do, a values exploration exercise. Identify the values that are yours. I also encourage you to, again, take away any judgment, and to identify your values, you don't have to actually be doing anything in line with it, right? That is actually an opportunity for us to know that, oh, you have this value, but you're not really doing anything with it, right? That's an opportunity to now engage in that behavior in some way that is in line with that value. So this can be really, really helpful. Now, mindfulness. I feel as though sometimes there are some misconceptions about what mindfulness is. And so, quick definition, when I talk about mindfulness, sometimes it looks like that, but it doesn't always look like that. So being mindful is being in the present moment without judgment, with a stance of curiosity. So that's a pretty broad definition. I realize that. So a big part of being mindful is choosing what we want to focus on, right? So I think, for example, maybe that person, they might be focusing on their breath, and they are taking time in their day to actively practice a formal mindfulness practice. So I want you to also start to think outside the box, because we do have formal mindfulness like this, where you can do a guided exercise and someone kind of talks you through what to focus on. When you have thoughts that are irrelevant, which happens to everyone, probably every 2 seconds for some of us, you just have to learn to realize that your mind has strayed and then gently place that thought to the side and then refocus on what you're choosing to focus on in the present. Maybe it's your breath. Maybe it is what you're eating. Maybe it's brushing your teeth. So I encourage you to think about ways that you might incorporate mindfulness in your day-to-day life without taking extra time to decide to do it. So informal mindfulness is doing things mindfully that we're already doing. So you can, like I said, mindfully brush your teeth. That's one I usually recommend for my patients, because I'm willing to bet most people brush their teeth at least once a day. So it's nothing extra that I'm asking them to do. You can mindfully wash dishes. You can mindfully walk, you can mindfully eat, you can mindfully do anything, right? So it is the act of just being in the present and being focused on what you're doing in the present and redirecting when your mind inevitably strays. We have a little bit of time, I think, so I'm gonna do a quick mindfulness exercise. This one's a little bit different. So it is a mindfulness of your hand. And I love doing this one because usually people have not tried this. And it is, we are going to be observing our hand as if we were a curious scientist. So if you would like to participate, I invite you to participate. If you do not want to participate, that is fine. It will not hurt my feelings. If you fall asleep, that is like the ultimate compliment that you're so mindful that you are in this complete state of not being conscious. So if you are participating, please get in a comfortable position. Please put both feet on the floor. And now, I want you to just turn one of your hands, palm upward, and hold it a comfortable distance from your face, where you can see it. For the next few minutes, I'd like you to observe your hand as if you're a curious scientist who has never seen a hand before. And from that perspective, first notice the outline. Mentally trace the outline of your hand, starting at the base of the thumb and tracing around all the fingers. And notice the shapes of the spaces in between the fingers. And notice where your hand tapers at the wrist. And now notice the color of your skin. Notice it's not just one color. There are differences in tones and shades, in dappled areas. And ever so slowly, stretch your fingers out and push them as far back as they will go, where it's comfortable. And notice how that color changes in your skin. And now slowly release the tension and notice how the color returns. Do that once more. Ever so slowly, noticing the color disappear and then return. And now notice the large lines on your palm. Notice the shapes they make when they come together or diverge or intersect. And go ahead and zoom in on one of those lines and notice how there are many smaller lines feeding into it and branching out of it. And now shift your attention to one of your fingertips and notice the spiral pattern there. The pattern that you always see in fingertips. And notice how that pattern doesn't stop in your fingertip. It carries down your finger. And trace it right on down and notice how it continues into your palm. And now ever so slowly, bring your little finger toward your thumb. And notice the flesh in your palm scrunches up. And now slowly release. And notice the flesh resume its normal contours. And now turn your hand to the karate chop position. And notice the difference between the skin on the palm and the skin on the back of your hand. And look at your index finger and notice that there's a sort of dividing line where those two types of skin meet each other. And ever so slowly, turn your hand over and notice the skin on the back. And notice any criticisms or judgments your mind makes. Notice any scars, sunspots, blemishes. And notice the different colors in the skin, where it passes over a vein or over your knuckles. And ever so slowly, curl your hand into a gentle fist. And notice how the texture of your skin changes. And notice any comments your mind makes about that. Notice your knuckles and gently rotate your fist. Notice the contours and valleys of your knuckles. And now tighten your fist a little and notice what happens to the knuckles, to the color and their prominence. And then ever so slowly, open your hand up and straighten your fingers. And notice how your knuckles just disappear. And now bring your attention to one of your fingernails. And notice the texture of the nail and the different shades of color. Notice where it disappears under the skin and the cuticle that seals it there. And now, ever so slowly, ever so gently, wiggle your fingers up and down. And notice the tendons moving under the skin, popping up and down like pistons and rods. And that brings us to the end of the exercise. But thank you for participating in that mindfulness exercise. Like I said, you can mindfully do anything. And I hope that was everyone's first time trying a mindfulness of your hand. And maybe you learned something new about your skin on your hand. All right, so I'm going to leave you all with a challenge. I want everyone to just think about what we talked about today. Gratitude practice, writing down 3 things that you're grateful for. 5, 4, 3, 2, 1 grounding exercise. Diaphragmatic breathing, belly breathing with pursed lips. Activity pacing for chronic pain or chronic fatigue. Exploring your personal values. And living mindfully. I would love if everyone would humor me and make a SMART goal. I'm a psychologist, let me do this. So, we love SMART goals. So, this would be a goal that is specific, measurable, achievable, relevant, and time-bound. So, let me give you an example of what is not a SMART goal. I want to be happier. Great goal. I have no idea what that means. I have no idea what that looks like. I have no idea how you're going to check that off. So please make a goal, such as, I'm going to try a gratitude practice 3 days for the next week. And if I meet that goal by the end of the week, I'm going to take a look at it and say, hey, maybe I can add a couple days next week. I'll make a new SMART goal. I'm going to try 5 days over the next week. And if you don't meet your goal, what got in the way? How can you readjust and say, okay, maybe I'm going to start with 2 days. I'm going to do gratitude 2 days a week, and I'm going to start there. So I encourage you all to think about it. Take one of these things, maybe that is new to you, or maybe it's a little refresher. Try it out. So really what I want all of you to come away with is that there are so many components of quality of life. This is just the tip of the iceberg. Of course, as a psychologist, I'm going to focus on the things that I think are really important and that I know about. Small changes are important. They make big changes over time. Think about those SMART goals. Make a small SMART goal. Continue to go back, edit it, make more SMART goals. Experiment with different coping strategies. I tell all of my patients this, is that a lot of what I do is trial and error. So we need to try things. We need to try them more than once to see if they're going to be helpful for you. So I always recommend at least try it for a couple of weeks before you decide it's not for you. So be patient. And lastly, be kind to yourself. There's a lot to be said for giving yourself a little grace of going through a hard time or learning something new. So please, have that voice in your head be kind. And thank you so much for your attention.
One of the things that I had realized about pain management was when I started with this hip replacement thing, right? It was last year. They said, oh, you're going to have hip replacement surgery. And I was traveling, whatnot, and that pain that I was having in my hip, traveling up my neck, and it was so intense. It was ridiculous. Then he turned around and said, well, maybe you don't need that right now. 50% of that pain went away immediately. I thought I was nuts. I told the doctor, and he said, oh no, he says, that's common. He says, there's studies that show that mentally you can add so much more to your pain just by thought. And he says many studies about that. So.
You're absolutely right. So there is a psychological component to the pain experience, right? And when you are anticipating something stressful, your body tenses. We know that's terrible for pain, right? So it's really important to learn to manage your stress and anxiety, and also check in with yourself and be like, hey, lower your shoulders, right? Unclench your jaw, because being stressed and being tense will absolutely make your pain experience worse, as will some of the thoughts you mentioned, right? So, and you know, when we think about pain, we have we call them catastrophizing thoughts. Those are things like, my pain will never go away, right? Or I'm always going to be in so much pain. Those kind of thoughts, they make pain worse. They make your pain experience worse. Absolutely.
My husband used to say that he thinks that stress level triggered my original cancer. I was working full time, and I was in a fast track MBA program, which that's not me. Not good in math and stuff. I really had to work hard. I was so stressed out about that. And then I got the lung cancer diagnosis just a few months into that. Would you care to address the stress on the growth of cancer?
Yeah, so I think there's a lot about stress that we don't fully know or understand, and that there's something in our bodies that reacts to stress, right? And so we know that our cortisol level tends to be higher. We get sick more often, right? So it lowers our immune system's ability to fight things like cancer. So absolutely, there's certainly a stress component that we may not know the direct mechanism or have a full understanding of what that is, but we know that high level of stress, so bad for your body, so bad. It creates a lot of inflammation as well.
One more question from Denise.
More an observation, having done pulmonary rehab, which I know a number of us have, I was taught pursed lip breathing. And I found that when I get in an anxious space now, I'm already breathing like that before I realize it. And I'm actually able to lower my blood pressure when
Yeah, absolutely. I love that you brought that up. It's funny because my mom's a nurse, and she had said too that, if you're stressed and you're anxious, your blood pressure, right? That's why, have you ever heard of white coat syndrome, when you're nervous about being at the doctor and then you're like, oh, my blood pressure's really high? That's your body reacting to stress and anxiety. So it's incredible that you have actually trained yourself to use that breathing automatically almost. It's like muscle memory, right? So that's incredible. That's exactly what it's for. So good job.
Thank you so much.
Yes, thank you all.